Hey, my friend, today I want to talk to you about one of my favorite topics lately, which is hair loss. I'm going to show you how you can use a laser light device to start to grow back some of the hair on your head. So stay tuned for this exciting episode. As I've been helping people look and feel younger, I noticed a common theme. People keep asking me about how to stop their hair loss and how to grow back some hair. And unfortunately, for many, many years, I had the same problem. For about 18 to 20 years, I was losing my own hair and I was struggling with what to do about it. And my scalp kept thinning and I was starting to lose my confidence. And I tried the lotions and the potions and the serums, but nothing had really worked for me. And to be honest, I was a little bit lazy, so I would try something for a few months and then I would stop, and then try something else for a few months and I would stop. But the net effect was that I kept losing my hair. My friend started noticing my thinning hair, and one day I was on a date and she said something to the effect of, "You don't have a lot of hair." And that comment literally destroyed my confidence, and I dropped everything and I flew across the world to go find and meet with some of the world's top experts in hair loss, hair restoration, and hair growth. And I took all their techniques and I implemented that into my own custom plan, which really helped me grow back a lot of my hair in just 3 to 4 months. And I'll get into my hair growth protocol and my program at a later date. But today I want to talk to you about how to use laser light to grow back some of your hair. My guest on this show is Will Gaunitz, and he's such a smart guy, and he's the founder of the Gaunitz Trichologist method, which he uses to help men and women beat back their hair loss and also grow back a lot of their hair. Will has been in the trenches of hair loss and hair growth for a long time. He's been losing his own hair for the last 23 years, so he's had to manage that. Plus, he's been helping clients deal with their hair loss problems for about 18 years, so he's eminently qualified to talk about hair loss and hair growth, in my opinion. He's my favorite person in the hair loss space, and he's one of my mentors, and he really helped me beat back my own hair loss. That's why I'm super excited to bring this episode to you. We recorded this a few months ago, and I can't wait for you to hear Will's expertise on this topic, which is laser light for hair growth. Will, welcome to the Anti-Aging Hacks Show. Let's start with the obvious question. You're a trichologist, and most people may not know what a trichologist is, so let's start there. What the heck is a trichologist?
A trichologist is a scientist of the hair and scalp. Unlike a dermatologist that focuses really on the entire skin system, a dermatologist is exclusively focusing on the scalp, and in doing so is going to be specializing in scalp conditions as well as specifically hair loss in a non-surgical form. The reason to go to a dermatologist would be if you have a scalp condition that may be scarring, painful, burning, may be showing signs of redness, papules, really a medical condition that may require any type of steroid or some type of diagnosis that would be indicative of an infection. The typical hair loss situation or the typical inflammatory reaction of an average person, you should start with a trichologist. But there are all different types of trichologists, and you really need to find a trichologist that's experienced, that has a track record, that is a part of a world-renowned society, which there are only two, and collectively has a proven history of getting results.
You definitely have your own history of hair loss, and you also work with clients. So how long have you been working with clients to help stop hair loss?
I have been working with hair longer than I ever thought. I've been working with patients with hair for 18 years. I have personally been dealing with my own hair loss situation for almost 23 years.
Wow, that is a long time. If I may say so, you have amazing hair. What is the secret to your hair?
The secret to my hair is tireless commitment to management. So everybody, knows they need to brush their teeth every day. They need to floss. People don't know that if you have a scalp condition or you have male pattern loss, that you have to do something every single day to manage that hair loss. And for the average person, I think it's difficult for them to wrap their head around doing something on a daily basis to either apply a topical solution or take a group of supplements for their hair. But their hair really is a reflection of general health. So if you're doing something that is going to help your hair, oftentimes it's helping your overall health. So for me, I have a 100% crazy dedication to making sure my hair is on my head.
There really is so much we can talk about hair loss and hair growth, but I want to specifically talk about your expertise with laser light for hair growth. So can we get started with what are the basics of laser light and how it works?
Low-level laser therapy for hair has actually been around since the mid-90s, and it won Time Magazine's Invention of the Year in 2001 with a single diode focused through a prism that was being utilized to help stimulate the hair follicles. The low-level laser therapy devices, all of them, fall in a very tight spectrum, which is between 630 nanometers and 670 nanometers. And this red light at 5 milliwatts is considered to be and FDA cleared to be a stimulating agent to speed up cell regeneration in the area of application, and in those cases, obviously, for your scalp and hair.
I'm familiar with some of the research behind red light therapy. It helps rejuvenate the skin, it beats wrinkles, it can also help reduce inflammation in your body. So there's a lot of benefits, and I use a red light device for my face and body, but I also use a red light laser cap that I bought from your website, Will. So for people wondering, this is a safe technology and has been FDA cleared, correct?
Low-level laser therapy has been FDA clinically proven to do a variety of things related to the skin, as well as help repair tissue, in some cases even cartilage, and decrease inflammation in tendons. But it specifically for the hair has had a wild change in method of delivery. Not only it started out in the clinics and then has moved to a cap form at home, but the first devices used in the clinic as little as 12 diodes. And we were one of the first companies to utilize low-level laser therapy in a clinical form, and our devices, again, had 12 diodes clinically, and we got results. And then they moved to 30, and then they moved to 60, then they moved to 107, and then eventually now you've got at-home laser devices that have as many as 350 diodes. So there is just huge disparity on the type of device, how much energy is being delivered, and that is not a benefit for the client because there's just too many variations, and there is documented science on what works, but everybody's got an FDA clearance because they've marked themselves as similar enough to get a 510K market clearance by the FDA for sales in the United States. So you just have this wide disparity of devices.
How can somebody get started or pick a laser device for hair growth? I mean, there's all kinds of devices, there's all kinds of diodes being marketed to people. So how does somebody dip their toes in the water or really get started with a laser light device?
So I tell people when we're using laser therapy to stimulate growth that think of laser like a medication. If you have a headache, you're going to start with one Tylenol, maybe two, not the whole bottle because it might kill you. If you are using laser and you go, I'm going to use the most powerful device known to man and use it every day, it's probably going to make your hair fall out because you're overstimulating the area and you can literally create trauma because there's too much energy. So you have to be conscious of the different types of devices. There is only a handful of clinical studies that show in a double-blind scenario what actually works. One of which is a clinical device that uses an 80 diode pulsing apparatus with 660 nanometers at 5 milliwatts, 20 minutes twice a week. Pretty much every other clinical study, or excuse me, every other 510K is based on that one study. And That one study says 90% of the people who were in the control group that was using the laser, not the placebo, had a benefit. And pretty much that amount of energy, 80 diodes at 20 minutes twice a week, is the sweet spot. So for the average individual. But you have to consider the color of your hair, because melanin attracts light. So the darker your skin, the darker the hair, less energy you need. The lighter your skin, the lighter your hair, the more energy you need, because you're not attracting light, you're reflecting it, and so you need more to get a result. So you have to consider these variables. Also, if you've been losing hair for less than 5 years, you're going to have a thicker subcutaneous fat layer. You're going to be able to absorb more energy. So if you have diffuse thinning, you're going to be able to absorb more energy than somebody who might be totally bald up top, who's been losing hair for more than 5 years. So my recommendation is less than 5 years, less energy. More than 5 years, more energy. So personally, we use an 80 diode laser cap, and I start most people off at 10 minutes twice a week. And also, pulsing isn't nearly as effective as static beam or non-pulsing. So now there has been a revival of static beam devices, but my devices have always been static beam and have never pulsed. And we even did a clinical study when we were getting ready to launch the THL1 laser back in 2006, where we used a pulsing focused line generated beam, and it didn't work nearly as well as a static beam. So these are things that you don't hear in the open market because they think, oh, pulsing, it's going to mimic your own body's frequencies, so it's better. But there was no clinical data to back that up. So again, it's got to go back to historical success. So you have to find a device that makes sense, that's got clinical data to back it up, and isn't most likely the latest and greatest. It's the tried and true that's been there this whole time.
Yeah, that's a great distinction. When you go back to see what really works, you'll notice that an 80 diode device is plenty, and you don't need the 300 diodes, which comes with an increased cost, of course. So go with what works and not what's been hyped up, which means you can skip the 300 diodes and go with an 80 diode device that's more affordable. The second part of this, which I'd never heard before I met you, was that lighter skin needs more energy, so you spend more time on your head, and darker skin needs less energy, so the device is on your head for a lesser time. What are your recommendations for people with different skin types?
What I'm recommending for laser use has a variety of different thoughts behind it. So one, you got to use what works. So again, 80 diode static beam device works. So you can use that. You can take down the dosage up or down based on who you are. So if you are dark skin, dark hair, you can use it for 10 minutes or 5 minutes twice a week and get an exceptional result. If you have light skin and light hair, then you can use it for 15 minutes twice a week or 20 minutes twice a week and get an exceptional result. So it works for most hair types. You just basically take the dosage up or down.
So let's talk about the devices out there. There's obviously many types. There's laser caps, there's combs, there's wands, there's helmets. I have been served ads over the years by marketers for all of these different types of devices. I've also been to aesthetic and hair loss conferences where I've seen all these devices and the manufacturers showing them at their booths, for example. So what do you recommend for most people to start with or to use for a hair growth regimen?
When it comes to laser devices, I also think of overall functionality, because someone has to use a device regularly for a period of time. So if it's prohibitive to use it, people aren't going to use it. So combs, outdated, unnecessary. Even if you're trying to save a buck, you can find a laser cap that you can rest on your head and do other things that is going to be probably the same price. And you don't have to move it. So there's also a band, not just a comb. Same thing, you have to move the band. Don't waste your time. Just go ahead and get a cap. It's easier to use, you can put it on. You can really measure and quantify what you're doing on a scientific basis, because if you're really subject to how your shoulder feels that day when you're using a wand, you're gonna just create variables. So combs, wands, out. Caps, you want to use the appropriate amount of energy. Do not get a device that has an exorbitant amount of energy. To me, the sweet spot is around 80 diodes. So, and it doesn't pulse. It is a static beam. So obviously my device, the LC Elite, does that. There's one other device that does it as well, but you want to make sure that you're in the 80 diode range, except under certain circumstances where you've been losing hair for a very long period of time, and you are also typically a male with a baldness in certain areas, and maybe have used lower intensity laser for an extended period of time and basically became resistant to it. So you had to increase to get some type of stimulative effect. But again, that's not a common situation. So I recommend 10 to 1 80 diode devices to higher power devices. So, and clinical devices, sometimes there's a lot of good devices out there, because a lot of the clinical ones are 80 diodes, 60 diodes, 107 diodes. They're in a normal clinical range before they got outlandishly powerful. Those, you have to drive to it twice a week to sit underneath it for 15 to 20 minutes. You're going to spend more in gas than you would to basically go and buy a device on your own. And a lot of these devices like ours, it's $900, it has a lifetime warranty. You're not going to ever need another device. So just buy it, use it, and when you're done using it, which I only recommend to use laser up to 2 years initially, and then you trickle down, and then use it maybe once a month, or just stick it under your bed until you have another episode, or maybe you'll never need another device. But don't overdo it. You need to use it for what it's intended, which is a growth stimulative effect. Use products and topical applications to block the reason for the loss, not laser. The laser helmets are just a different package of the cap. The energy themselves is the same. No one is doing anything unique when it comes to low-level laser therapy for hair growth at this point. It's just a repackaging of the same thing. Again, the thing you want to be focused on, how many diodes? Obviously, history. So, I mean, if it's a brand new device that has no track record, it may break. There's a variety of, electronics that are in it. But how many diodes? Does it pulse or not pulse? Because you want no pulse. And essentially, is it easy to wear? And that's it.
I agree with you 100%. Many years ago, I bought a laser comb, and I believe I paid a few $100s for it. And I was super excited when it showed up in my house, and I was ready to use it. And the first couple of times I used it, I realized that you actually had to hold it up to a specific section of your hair, and then you got to move it to the next section, and to the next, and to the next. And my shoulder muscles got really tired in just a few minutes. I didn't realize that my shoulder muscles were that weak. And it's not that my shoulder muscles were all that weak, it's just that we're not used to holding anything up above our head for any prolonged period of time. That is why those muscles get tired. So guess what happened? After the third or the fourth time of me using that laser comb, I put it in my closet and I never use it ever again. And that was a complete waste of money. So I agree with that recommendation. Go with the laser cap. It's easiest to use. When I use a laser cap, which I do 2 to 3 times a week, I don't even realize I'm using it because I'm usually checking my email or drinking my coffee or doing something else, which is super easy. I don't have to pay attention to or hold up something above my head. So that's my recommendation. Now, Will, I know that this is FDA cleared, so it's safe to use, but is it safe for everybody? Are there certain people that should not be using a laser cap or a comb or helmet, for example?
There are risks and side effects to lasers. People don't look at laser like there are potential risks, but if there are positive benefits, then there are absolutely potentials for negative benefits. So anyone that has an inflammatory scalp condition, psoriasis, seborrheic dermatitis, alopecia areata, anything that's causing the immune system to essentially overact on the scalp, then if you add laser to that, then that inflammatory condition can be aggravated. So you're creating stimulus and energy to a given region on the scalp. If you pump energy into inflammation, you're going to fuel that inflammation. So you have to make sure that if you're dealing with those types of issues, that you've at least mitigated them through nutritional factors, the right shampoo, scalp conditions, getting your vitamin D3, ferritin, folate, zinc, all that in the appropriate ranges, and begin going very slowly with laser. You use a very low-powered laser for a very short period of time and ramp yourself up as to not create aggravations. People also too who are on blood thinners, warfarin is a big one. When they use laser, it seems to have a very negative sort of contraindicated effect. And if you have full-blown scalp psoriasis and you use laser, that scalp psoriasis will flare and it will get bad. So I have seen hundreds of cases where we've tested that theory, and I've met with patients and said, hey, you've got scalp psoriasis. If we laser, which is against my wishes, then you are knowing that it could potentially flare. And 9 times out of 10, it flares. So psoriasis is one of those beasts that is better left unlasered.
Yeah, that makes sense. So can a laser be used for all types of hair loss, or is it only effective for certain types of hair loss?
A laser can be used for all different types of hair loss with the exception of scarring alopecias. And they work very well at speeding up the result. So if you are dealing with male and female pattern loss and you're using it with DHT blockers, then it can be very effective. If you have not blocked the underlying reason for the loss, best case scenario, you break even. In a case of nutritional loss, if you have mitigated all the nutritional factors, it will speed the regrowth substantially with nutritional loss because there's really nothing to hold you back. And so you're just cruising along growing new hair to maximum capability. If you do not resolve the nutritional loss, and let's just say D, zinc, ferritin, folate is all low and you laser, you will dump hair. And the reason for it is that your body is already starving that hair follicle because it's demanding your own nutrition to go to the vital organs. So when you're speeding up cell regeneration on the surface of the scalp, your body's going, oh man, the demands have really increased on that scalp. We're going to withdraw even further.
That makes sense. There are so many tips that I learned in this interview about laser light that I'd never known before. So thank you for sharing those, Will. If you've been considering using a laser device for growing back some of your hair, I highly recommend it as part of your hair growth regimen. I personally have been using a laser device that I bought from Will's website, advancedtrichology.com. I'll put the link in the show notes below, but it's part of my hair growth regimen and it's yielded some really positive improvements to my hair. My hair is thicker and better than it's ever been before. And of course, I'm using many techniques, but a laser cap is part of my strategy and my approach that I use every week. So overall, I highly recommend the laser cap, but as Will pointed out, you want to make sure that you address the root causes, the reasons you're losing your hair first before you add on hair growth promoters, which actually grow your hair back. Okay, so you want to address what's causing your hair loss, stop the hair loss, and then start to grow your hair back using a few techniques. And this is part of the hair growth technique. So do that first and then do the hair growth techniques. But if you want to get a laser cap, I would recommend getting it from Will at advancedtrichology.com. I put the links in the show notes below. Will, thank you so much for coming on the Anti-Aging Hacks show. I really appreciate your deep knowledge about laser light for hair growth.